السلام عليكم، يعطيكم العافية جميعا. بلش محاضرات the clinical part of the bacteriology course. This will have a brief review of the anaerobes, and we will talk about gram-positive cocci. The second part المحاضرة القادمة أو المحاضرتين القادمتين بعد هدول المحاضرتين راح يكونوا about the gram-positive bacilli. So let's begin. This is a very important table. This gives you a good breakdown of what you need to know during this clinical course. So we have, let's say, if you take any gram-stain reaction and each shape, you will come up with a few organisms. So the gram-positive cocci, the main ones are staphylococci and streptococci, and with them comes the enterococcus. When we talk about gram-negative cocci, we will talk about Neisseria. The gram-positive rods راح نحكي طبعا عن the important ones that are anaerobes هم راح يكونوا Clostridium وبacillus. بعدين راح نحكي عن the other gram-positive rods كون بكتيريا دفتيريا بتعمل دفتيريا، وراح نحكي عن الليستيريا. And it's good to know about nocardia and actinomyces as well. And then we'll talk about the gram-negative rods اللي هم راح يكون أكبر مجموعة، نقسمهم إلى مجموعتين أو 3 مجموعات. The enteric ones, the ones that cause enteric infections, the ones that are inside and outside the enteric tract اللي هم راح يكونوا E. coli and Salmonella, the ones that are primary in the GI tract will be Shigella, Campylobacter, Helicobacter, Vibrio cholera, and then the ones that can cause outside Klebsiella, Enterobacter serratia group, Pseudomonas, bacteroids as well. These ones where they cause disease basically. So then بعدين نحكي أو قبل هيك نحكي عن respiratory tract organisms. راح نحكي عن Haemophilus influenza, Legionella, and Bordetella, which causes pertussis. بعدين, maybe if we have time, inshallah, we'll talk at least about Brucella and Yersinia, the ones that come from animal sources, هم الzoonotics. بعدين بنحكي عن the ones that do not stain with a gram stain. راح نحكي عن at least Mycobacterium and Mycoplasma, and just mention about Chlamydia and Rickettsia, that they are the intracellular organisms, obligate intracellular organisms. So that's this table gives you basically that's the course. The most common notifiable bacterial diseases هاي مهمة especially for license exams بيحبوا يعرفوها إنه what do you do, do you report this, do you not report this. Basically anything that might cause a disseminated infection can cause an epidemic. You want to notify. Chlamydia, gonorrhea, the ones that cause the common bacterial STDs, هدول always notifiable. في دائما public health section دائما موجود, especially in the US and the UK, that you always have to notify, and then they do contact tracing للpartners. Salmonella, because of it might cause an outbreak. Syphilis, it's still present. Lyme disease in the US and in parts of Europe. Pertussis, invasive pneumococcal disease, shigellosis, much like salmonellosis, and TB as well. And راح نحكي عنهم اللي هي hemolytic أو الشيجا toxin producing E. coli. So let's cover a little bit about anaerobic bacteria before we get into the gram-positive cocci. So anaerobic bacteria are characterized by their ability to grow only in an atmosphere containing 20% or less oxygen, so less than a normal condition. هدول يسموا anaerobes. بدنا نفرقهم عن obligate anaerobes, which cannot live absolutely يعني without presence of oxygen at all. So they can't tolerate oxygen at all. They are diverse group. كلهم من البكتيريا that barely grow in 20%, microaerophilic up to 10%, to those that only grow in less than 0.02 oxygen, هدول strict anaerobes مثلا زي الكلوستريديوم. The table that or the second slide that we come to describes these conditions. في وبالعكس There are obligate aerobes such as مثلا Pseudomonas aeruginosa is an obligate aerobe which grows best in room air oxygen, and then they do not at all grow under the less than 20% oxygen. هلا facultative راح يكونوا بالنص. They can live either or because they have fermentation capabilities within them. هلا aerotolerant مثلا في Clostridium histolyticum. I don't think we will mention this in this course more than this, and it can grow to some extent in air and but multiply more readily at lower oxygen concentrations. Microaerophilic organisms, Campylobacter jejuni كتير مهمة. Campylobacter is a major cause, or أحيانا it's the most common cause of diarrheal disease. It requires a reduced oxygen concentration, وهذا إشي موجود in the GI tract. Obligate anaerobes الموجودة عندنا in our GI tract are bacteroids, the dominant one, and Clostridium, especially Clostridium perfringens. They almost live in a total lack of oxygen, and they actually live in our gut. So do we have the actual environment where in our gut? Yes, we do. In our crypts, in the guts, the oxygen concentration will be low enough, and شو إشي كمان بيساعد the presence of facultative anaerobes which will consume the oxygen. Once they consume the oxygen راح تلاقي الانايروبes بيعيشوا تحتيهم in the condition where the oxygen has already been consumed, and that's where they live. So many of these anaerobes they will use nitrogen rather than oxygen as the electron acceptor. So oxygen requirement for these representative organisms. فمثلا من an obligate aerobe زي Pseudomonas to an obligate anaerobe زي bacteroids, and then بالنص راح يكون عندك the dominant group اللي هو facultative anaerobes, and then you have these aerotolerant organism مثلا Clostridium histolyticum and the microaerophile مثل Campylobacter jejuni. This is important to know, and we can see how the growth will change from aerobic and بصير بالfacultative بيعيشوا على 2 more so on the aerobic side, بعدين بصيروا يعيشوا أكتر على الanaerobic side. This is sometimes comes up in license exams. إنه C. jejuni grows best in 5% O2 with يعني it has it requires more CO2 to improve its growth from +1 to make it maybe more +3. This is an older slide showing what we just mentioned from obligate anaerobes where they live higher on the tube if you put in the tube where the oxygen is highest, to obligate anaerobes where they live only on the bottom where the oxygen is lowest, to facultative where they live everywhere but more thriving on the top, to 5 aerotolerant, they live everywhere uniformly, and the microaerophile where they have a tiny band of oxygen concentration where they can live in, and then not anywhere else. So the main reason why anaerobes can't tolerate the presence of oxygen حكينا because they don't have the enzymes SOD and catalase. They can't deal with the oxygen species that will destroy their DNA. What they do is that these two enzymes will eliminate the toxic compounds of hydrogen peroxide and superoxide زي ما حكينا في المحاضرة السابقة. Another cause of why anaerobes can't live in the presence of oxygen, similar to temperature زي ما حكينا, temperature, pH, salt conditions, how they affect enzymes, and then the enzymes and their proteins don't function well. The other cause here, and the third cause, is that oxygen causes the oxidation of the essential self-hydro groups in certain enzymes زي ما حكينا, and then they don't have sufficient reducing power to regenerate these enzymes. So in addition احنا كمان عندنا هون the oxidation reduction potential. تذكروا لما كنا نحكي عن metronidazole, how it affects this, and then how metronidazole is a drug that we use for anaerobes. So this potential is affected, and then areas with low potential such as مثلا الcolon, certain areas in the mouth مثلا حوالين dental plaque, and the periodontal pockets, they support the growth of anaerobes for that reason. هلا crushing injury بأي منطقة will reduce devitalize the tissue، راح يوقف البلد سبلاي. دائما فكر فيها البلد عبارة عن ناقل أكسجين، فأي منطقة فيها أكسجين كتير راح يزيد الأكسجين، راح يقتل الانايروبس. فمثلا if you exercise regularly you are improving your blood supply everywhere and then you are eliminating more anaerobes and that includes the gut. So a crushing injury that will eliminate the blood supply, مثلا surgery مشكلة they ligated an artery or something, downstream this will become a low EH environment which will improve the growth of anaerobes. For the oral cavity, so the human oral cavity is home for many bacterial species. Actinomyces, this is one of the main anaerobes of species in the mouth. Actinomyces causes this painful abscess formation around the mouth, GI tract, and in the lungs. Bacteroids, again, GI infections and mouth infection. Bifidobacterium مهمة. Fusobacterium. Lactobacillus is a normal flora and it's commonly known to be to help in the digestion of many foods, especially dairy products. Piptostreptococcus as well. These are the more common ones that we need to know. The makeup of these species depends on the patient's age. This is important. For infants, they have less incidence of anaerobes, and as the body grows and there are more cavities and then more growth of facultative anaerobes, the anaerobes start to increase in number, and the balance tips towards the anaerobes بالGI tract. In adults, anaerobes are more common, and they are more common مثلا gingival sulcus and that in the saliva maybe, and in the crypts all along the GI tract. So in a healthy sulcus, you will have that the gram-positive bacilli are found around 5 to about 15%. The gram-negative bacilli are more so from 13 to 30. And then the other, these are the two dominant groups. So in saliva, we have to know that Veillonella is the most numerous anaerobe. So let's get to talk about the dental plaque in the mouth. So after the beginning of formation of the supragingival plaque, this is about 3 to 12 weeks. The makeup of the microflora in the plaque begins to form. So this microflora is mainly made up of gram-negative anaerobic bacteria and including some motile species. The main characteristic of this bacteria that they have to establish a plaque is to adhere to the tooth surface. If they can adhere, if you stop mechanical brushing, انت مش ما بتعمل brushing, you stop the saliva, كل هذا بيساعد على these bacteria to adhere to the tooth surface. Once they adhere, they can start producing the plaque, epithelial or other, and the tooth surface or other surfaces as well. Bacteria are the main common cause or the primary cause of periodontal disease. So for dentists, that will be their bread and butter. Basically, bacteria is the main source of your income. So the bacterial numbers associated with disease are up to 10 times larger than those associated with health. So the plaque will eventually cause decay of the teeth اللي هو بسموه dental caries. Due to the production of لما يعيشوا البكتيريا تحت الكاري تحت البلاك, they keep as they are growing, they are producing acid. This acid will over time degrade the enamel and cause اللي هو اللي تعرفوه الكاريز. So let's look a supragingival plaque being formed around these parts. تشوفون هنا هيك. So if we look at the plaque on the other side, so this is where bacteria start to move in, and then the tooth attached plaque will be on this side, and this will be the epithelial associated plaque on this side. Epithelial هنا بكون tooth associated, and then you will have between them an attached plaque. So if you brush لما تبلش البكتيريا من هون if you brush you are removing this bacteria. If they start moving in خلاص صار يعني it'd be hard to get rid of it, so it would require مثلا more aggressive techniques, and then the bacteria can even invade to the tissue and even more deeper if it overgrows as well. So anaerobes in the dental infections, anaerobes make up a significant part of the oral and dental normal flora and pathogenic flora. Their role in disease and root canal infections, infections of the hard and soft oral tissue, as well as the remainder of the GI tract. Common anaerobes اللي بيعملوا that we isolate هم اللي حكيناهم Fusobacterium, Bacteroids, Actinomyces, Streptococcus, Streptococcus. These are the main ones. So first, if we want to come up with something more, is that we see that actually the circulating levels of hormones can affect this, and مثلا they were shown to be stimulatory for bacterial species مثلا pregnant women, so they are more prone to have مثلا gingival infections. Second, bacterial invasion of the soft and periodontal tissues in the GI tract and the mouth has been documented to cause gingivitis, advanced periodontitis, and even local juvenile periodontitis. So I think that's good to know. If we know from this, if you aim antibacterial probes against these bacteria, they may control and or arrest these sort of infections. So the main pathogens اللي هم been in these gingival diseases, Porphyromonas, Tannerella, and Treponema are considered the main pathogens involved in periodontitis, and then they are regionally detected using PCR. So the biofilm infection, this is the يعني زي ما تحكي, this is if we are increasing, يعني بنضيف على القصة اللي قدام شوية, we're talking about how this happens. So if we go back to this slide, everything is يعني if we go back to this slide, now we are continuing on this slide. Now once bacteria form, هاي القصة بتنتقل من فوق لتحت. So we first have primary aerobic bacteria. They are on the top towards the mouth, the oral cavity. You have the primarily aerobic bacteria, and then all these are they love acid, they can cause cavity, and then you have a transitional area where lots of facultative anaerobes live, and then they consume the oxygen. Here they consume the oxygen, and then تحت راح يكون oxygen concentration is low enough for primarily anaerobic bacteria to live. Above here the acidity level راح تكون أعلى من هون, and then the pH will rise as you go down. So بنضيف على القصة هاي اللي هو biofilm formation. The formation of biofilm will prevent or reduce oxygen as well, and help the facultative anaerobes and the anaerobes to live under the biofilm, and then cause destruction of the enamel layer under it. اللي هنا Streptococcus mutans اللي بتعرفوها is the main facultative anaerobe in this story, and then Scordoni early is the early colonizer with Oralis and Sanguinis. All these are part Streptococci, so they're just different mutants, Scordini, Sanguinis, Oralis, and then they all are the early colonizers زيهم اسمائهم. They all come وزي ما حكينا هالقصة, they consume the oxygen. As they are consuming oxygen, they are living, and they are producing energy, they are producing acid, which demineralizes the enamel layer. So the anaerobes of medical interest are presented below. هذا كتير مهمة. These range from the gram-positive rods and cocci to gram-negative rods and cocci. So the rods and the gram-positive rods عادة اللي هم the ones that are producing are anaerobes. في عندنا اللي هم حكينا الكلوستريديوم والباسيلس. So عادة احنا نقسم الروds the gram positive into spore formings and non-spore formers. So out of the spore formers راح تلاقي gram positive spore forming rods اللي هم الكلوستريديوم. Only spore formation is only happens, you can only see عادة in gram positive rods, that's it. So the only one that is positive and a spore forming will be Clostridium, the other are all non-spore forming. هلا بين gram negative non-spore forming rods, the main ones would be هيهم bacteroids and fusobacterium, and then gram positive non-spore forming rods هم أهم وحدة اللي هي Actinomyces, Lactobacillus, Bifidobacterium. These are common ones that عادة بيطلعوا بالامتحانات. non-spore forming هلا خلصنا الرودز نحكي عن كوكساي. non-spore forming rods هم الستريبتوكوكس, Piptococcus, the cocci. So these are all gram positive. والفيليونيلا اللي هي the main one seen in saliva. So these are the anaerobic bacteria of medical interest that we need to know. Clinical infections. Many of the medical important anaerobes are part of your GI tract, including the normal human flora. So they are normal there, they are non-pathogens in their normal sites, but they are pathogen if they leave those sites. Two major exceptions to this rule in the anaerobes اللي هم Clostridium botulinum and Clostridium tetani راح نحكي عنهم قدام شوية. The ones that cause botulism and tetanus هدول اثنيناتهم are things that affect the nerves, and then toxin producers that affect the nerves, and then they are found in soil. هدول عادة مش part of you never find them as normal flora. Clostridium perfringens can be found as part of your normal colon and soil. Anaerobes, the hallmark disease here is the formation of an abscess. ليش؟ أنا جوا الabscess I am walled off, I'm destroying the tissue, I'm devitalizing the tissue زي ما حكينا. If I devitalize the tissue and then I am further reducing oxygen and I'm further improving my environment for my living. So that's how anaerobes usually cause. Abscesses عادة are polymicrobial. بيجوا القصة نفسها بتنعاد. بيجوا facultative anaerobes, they destroy the tissue, they devitalize the tissue, then the anaerobes come in. Now the tissue is devitalized, ما فيش oxygen, then I will thrive, they start to thrive, they start to replicate more, and then the body tries to wall off this infection by formation of abscess. كل هدول يكون dead cells, dead neutrophils, dead bacteria, dead whatever, and that is usually the makeup of an abscess. So these can be encountered wherever anaerobes can reach, anywhere. So they can cause an abscess in the brain, نفس القصة, facultative anaerobes, بعدين anaerobes, lungs, genital tract for the female, biliary tract, intra-abdominal size, and periodontal abscesses as well. Most abscesses زي ما حكينا are polymicrobial, for the story that we mentioned of the facultative anaerobe devitalizing the tissue to improve the condition for anaerobes to live. So هاي هي القصة, هي consume sufficient oxygen in the abscess which allows anaerobes to flourish. هاي حكينا. So on physical examination, what do you see? What are the main symptoms of an anaerobic infection? مثلا واحد عنده diabetic foot, واحد عنده anaerobic infection anywhere. عادة if it starts to produce gas, you will find عادة it usually produces gas and you will have a foul smelling discharge. عادة يعني ما بقدر أحكي لك ما بقدر أوصف لك بالمحاضرة. يعني it smells like rotten eggs. It has a unique smell. بتروح على إذا بتروح على المستشفى روح على well maybe not now, just wait. So if you go to if you smell it once you will know it. هلا this production of gas can be felt as a crepitus under the tissue. بتحس التissue, you can feel the gas, and then you see the devitalized tissue اللي هو خسران arterial supply, فراح يصير هذا التissue necrotic, راح يكون لونه أسود and devitalized and dead basically. So to diagnose this to improve the success عادة في any microbiological diagnosis. احنا عادة بنحاول to improve our method to collect the specimen. يعني if you fail to collect the specimen, if you fail to touch the actual infection راح تقلل انت sensitivity. For anaerobes you have to كتير مهمة هاي, you have to rapidly transport it لأنهم if there is any presence of oxygen they will die, and then لما تيجي تعملهم culture راح تلاقيهم dead, and then you will report a negative result whereas it is actually positive. The third thing will obviously be culturing in appropriate conditions to increase their number and increase the sensitivity of you finding this infection. So this is main for all bacteria, and this is a special request here for anaerobes. So an appropriate specimen is the one that does not contain any of the normal flora. So blood, pleural fluid, pus, مثلا transtracheal aspirate, whatever you are wherever you are trying to collect your specimen. Secondarily, مثلا باللab, the cultures are handled and incubating under strict anaerobic conditions. فهذا to improve their growth. عادة you can do gas chromatography, which keeps measuring the gas, the types of gas in the specimen, to if there is organic gases. مرة بيحكي لك معناته the growth has happened, because as the bacteria grows they start producing gas, and you can detect this gas with gas chromatography. Treatment للanaerobes عادة first and foremost for an abscess من الآن إلى نهاية الزمان. First and foremost, any abscess دائما surgical drainage of the abscess is and then administration of antimicrobials. ما حدا يحكي لك إنه بتعطي عنده واحد عنده abscess أعطيه مضادات حيوية بتروح. It never works. You have to drain the abscess. There's no way around it. So abscess is drained and antibiotic. This is very important. So the drugs are commonly used to treat the anaerobic infections. مين؟ ذكرنا نعرفهم أدويتنا clindamycin, metronidazole, هدول مهمين. Brain infection حكينا chloramphenicol. If I have a brain abscess, that is something that I can use. And then some beta lactams مثلا, even penicillin G and cefoxitin can work. Many isolates of important pathogens مثلا bacteroids are resistant to penicillin, فإحنا عادة ما بنجرب penicillin عليهم. تمام, هون إحنا بنخلص حكينا عن الانايروبس. Now we will move to talk about gram-positive cocci. راح أوقف المحاضرة هون, and then بخلي محاضرة الgram-positive cocci طويلة. هاي المحاضرة نص ساعة. محاضرة الgram-positive cocci عبارة عن ساعة, عشان بس أقسمهم بالفيديو عشان ما يكونوا جنب بعض بنفس الفيديو يعني. But for your sake يعني if one بلش if you want to keep going for the full 45 minutes, you can keep going on the second video.